that you can tell us how we're doing. That way we can improve next year's health fair. So I'm welcoming everybody, and I thank you for coming. Feel free to go around every table. When you come in, you get your information at the desk. There are some gift bags just right next to the front. Pick them up and go to as much table as This is the health information session and also a screening, health screening.
How you doing?
Screening for blood pressure. So feel free to go around. We don't want you to sit down, we want you to go around. If you have any questions, just ask one of the guys that has t-shirts on that says SLNA, and they'll show it to you. Outside the gym, we have the bathrooms there. So again, we want to thank you for coming. Thank you so much.
We are with Mr. Commander of the STEM program. Mr. Commander, can you tell us a little bit about STEM and what you've been doing so far?
Okay, thank you very much, Mr. Sheriff. Actually, STEM stands for science, technology, engineering, and mathematics. What basically we do is we promote and support the learning of those areas that I've just mentioned. For example, last year we were helping these kids of color to be precise, from preschool age up to 12th grade. Last year we were helping them with after school programs. We helped them with their homeworks, with math homeworks, science homeworks. And then we focused last year heavily on robotics engineering, where we had a kind of really teach them how to program robots using Lego kits. And in fact, we took them for a competition where we have a bunch of teams that came together for that competition. And gracefully, we won 2 trophies and came back. And so basically, that is what we do in STEM.
Thank you very much. I would like to, as we go through the program, to talk to some of the kids who are participating in the STEM program. And thank you for that information.
Thank you, I appreciate it.
My name is Alice Thoronka, and I got involved with STEM last year, the beginning of my 8th grade. And STEM, like when I went to STEM, it helped me with like my math and my science and engineering. And as we developed into the program, we started getting more into engineering, and we started like building robots to accomplish missions and tasks. And we also went to a competition to, go on and go against other people and the robots. So.
Yeah, have you won any awards?
Yeah, we won 2.
Oh, that's wonderful. Well, thank you very much.
Hello, my name is Muhammad Karifa Jallo, and what we do at STEM is we program robots, and we went to the competition, and then we came in 3rd place. We have 2 trophies. One is for the core points and the other one's for the judge award. And basically how we got them is, the judge award is when we were doing our presentation to the judges, they said we had good team cooperation, and also that we had our presentation was like one of the best. And how we got the core competition one is when we were doing like rounds, like a tournament round, and then like the more points you get, the more points you get on your team. Yeah, and that's basically it.
Thank you very much, Mom.
Hi, my name is Sade, and I'm going to talk about STEM. So what we do in STEM, we just learn about engineering and science and also math, and we do different missions and just have fun.
Thank you.
My name is Jeremiah Poja. I'm from Liberia, but live in Minnesota. I train healthcare providers. The name of my school is North American Medical Academy. You can see the name of that is there. If you want to be a nursing assistant, whomever TMA, just come to us. We'll train you and help you with job placement.
So where do you do the training?
52 and Bryan. The address is right there.
So that's the address?
5201.
Okay. Thank you very much.
All right, thank you.
Yeah.
Hello, my name is Rita Apollo. I'm here at the Sierra Leone Nurses Association Health and Wellness Fair, and I'm really happy to be here. I'm here as a vendor, sort of with my book today. It's called African Women Connects. How I created and grew a network of African women immigrants in the Twin Cities area for friendship, business, and community. And so I'm just here to sort of connect with the community. I have some fun things to do at my table. Health and wellness relationship building is very important for health and awareness because that's how we connect with each other. It's good for our psyche. We need to be out and meeting other people and having fun is all part of being a healthy person. So come on down and chat a little bit and check out my book. It's $20 a piece. Thank you. Yeah.
I'm Husanatu Kamara. Today is April 27th. We are actually celebrating our second annual Sierra Leone Nurses Association Wellness Fair. We're excited to be here. We're excited to be a contributing factor to the health and wellness of our community in Minneapolis, Minnesota. Today I am actually officiating the table for diabetes. We have other vendors, the tobacco health. Especially I'm excited that they are here because a new bill was entered into the House. The legislature introduced the bill, the Tobacco 21 bill, which actually teaches or helps prevent illegal purchase of tobacco to young adults in the community, especially when we have so many health disparities, including diseases of emphysema, COPD, and being in the healthcare field, it makes me very anxious when I see kids around adults that are smoking and making it look like it's a healthy habit. Unfortunately, it's not. So as SLNA member, we hope that we will continue to contribute not only in the healthcare here in Minnesota, but also focusing on our people back home in Sierra Leone.
So my name is Nancy. I'm a member of SLNA, and my presentation here is on heart disease. And this heart disease really refers to several health conditions, and it's a big, important thing to know because it's one of the main leading cause of death, especially in racial population. So with our presentation here, we have some statistics. We have some statistics on death related to racial groups, related to heart disease. So for African American or the Black community, it's 18.4% death rate. And I think a lot of it has to do with our diet and how we eat and our exercise pattern. So we also have some risk factors that talks about behaviors that relates to heart disease and changes that we can make as far as exercising and choosing our food choices, baking versus frying our foods, less salt, more exercise. And also these are risk factors that are related to heart disease. So you have diabetes, high blood pressure, high cholesterol. And then we have a brochure that we're handing out to our guests to take home, kind of a reference on basically everything that we have in the presentation that they can use and refer to as needed.
Thank you very much.
Yep.
My name is Fatima. I'm a member of Fatima Masakoy. I'm a member of SLNA. And I want to talk about high blood pressure. I did it last year and I'm going to talk about it again this year because I'm passionate about it. High blood pressure leads to, cardiovascular disease, and it's like the beginning of everything. And once you have high blood pressure, things can happen. You could have a stroke, you could have a heart attack, and there's so many ways we can modify our lifestyle that could help us. We could eat less salt. There's a DASH diet, You see that in the supermarkets where the DASH seasoning, you can use that. You can use herbs and spices to season your food other than all that salt, Lifestyle changes such as running around, instead of taking your car, you can run or you can walk, go for a stroll in the evening. There are a lot of things we can change our lives that could really enhance the way we live. So if you have high blood pressure, time to manage it. Check your blood pressure daily, as often as you can. Take medication if you're prescribed medication and live a better, healthier life. Thank you.
Hi, my name is Lucas Zucker, and I'm a community outreach specialist with the Metropolitan Area Agency on Aging. And we deliver the Senior Linkage Line service in cooperation with the State Board on Aging for this region of Minnesota, the 7-county metro. And we do all kinds of things. We're an information and referral service, so people can call us at the 1-800 number, and we can connect them to different services and providers in their area. We also provide Medicare counseling or health insurance counseling over the phone to seniors, people with Medicare, those who care for them. We do housing counseling as well to talk about different housing options for people in the metro. And just in general, there's a lot of different supports out there for seniors in the community, and we like to connect people to the things they need.
I'm Shelby Wolf. I'm a West Metro Fire Rescue District. We're with the fire department for New Hope and Crystal. And I guess I'm here just to talk about fire safety and how to be safe in your home. And I think probably the biggest thing for everybody is just when you're cooking, don't walk away when you're cooking. Our #1 fire problem is cooking. So grease fires, don't use water, put a lid on it, make sure you turn off the stove, and just don't ever walk away. Check your smoke alarms at home, make sure that they're working, change your batteries every time you change your clock. And if you have any questions, feel free to call West Metro Fire Rescue District, number 763-230-7006.
Thank you.
Thanks.
Thank you.
Yeah.
All right, so my name is Eddie Barrera. I'm with Wells Fargo. We're at the Wells Fargo at Work program, and this is
Brianna Fry. I'm a personal banker at Wells Fargo, also with the Wells Fargo at Work program.
Exactly. So, and we're just giving a little bit of financial education, nothing major, just little fun gifts for the kids and for whoever else wants some information.
Okay, thank you very much.
Yep.
My name is Esther Mwangi.
And I'm Lauren Scott.
And we're here from the Minnesota Department of Health in the Refugee and International Health.
So today we're talking about malaria prevention while traveling back home to visit friends and relatives. We have a 5-year CDC-funded project to try to reduce the number of malaria cases we see diagnosed back in the United States. So we have some resources here today to talk about what precautions you can take when traveling to a malaria endemic region, and also if you want to get prevention medications, where to find them, how to talk to your doctor about them, and also some things about how to reduce the cost of malaria medications since they're usually not covered by insurance.
Yes, and in addition we have information on symptoms, on how to recognize symptoms for malaria, as well as
how to talk to your doctor.
How to talk to your doctor, potentially
diagnosing malaria since they don't see it.
I am Sheku Samba. I work on tobacco policy programs. I work particularly with Minnesotans for Smoke-Free Generation in collaboration with the Association of Non-Smokers. We work on policies in order to increase the age of smoking and also restrict the sale of certain tobacco products like menthol and other things, and flavored tobacco products. We have succeeded in increasing the age of smoking from 18 to 21 in Edina, St. Louis Park, and we have done it in other cities. Now we are working in Brooklyn Center. But we do it in collaboration with the community. We want the community involvement. We want the communities to write that to their elected officials so that they can receive these letters and know what the community wants. So the elected officials can also take this sensible policy in order to protect the lives of our people. So we want each and every one of community members to come up. We cannot do this thing alone. We have to do it in collaboration with you. We need to protect the children's life. Work with us. Thank you.
Okay. My name is Fatima Ngekia, and this is Mimi Mugaka. We're here in the health fair, Sierra Leone Nursing Association health fair, trying to help our community, educating them about good health regarding the nutrition. This is the poster that we're using to show them and teach them proper nutrition, the servings that they should be having, things that they should be paying attention to more about, like diabetes and hypertension, cholesterol, food that causes all those health hazards. Young children, and we also have information for them where they can go whenever they need help or get more information about their diet. In the African community, we found out most of them have hypertension, and because of their diet, and good education will help them. And also mothers that are expecting, we help them to get a proper diet so they can have healthy babies. This is what we're doing here this evening, and I thank you. Thank you all for coming.
My name is Hassan Kamara. I'm here to present about RENA systems to the community. The RENA system they do with kidneys in our body. The kidneys are very important organs, being shaped at the lower back of the abdomen. They have a lot of roles to play in our body. Kidneys help to balance electrolytes in our body, remove toxins, control blood pressure, red blood cells, make our bones stronger, etc., etc. The risk factors associated with kidney disease are diabetes and hypertension. Those are the leading causes of kidney failure in the US. Simply because most of the food we eat are either too salty or too sugary. So those are the two that causes diabetes and hypertension. Now, when you get kidney disease, what are the symptoms? You become fatigued, you get edema, you itch too much all over the body, there's urinary retention, heart problems, and even breathing problems. Simply because the renal system affects a lot of other organs in the body. Now, how do we prevent kidney problems? We can prevent kidney problems by eating a balanced diet. Not smoking, exercises, avoiding alcohol, and other stuff that you may need to do. If all else fail and you happen to get kidney failure, then what do? You have to do what we call renal therapy. That is, you either do dialysis or you get a kidney transplant. Your third option is not to do anything, and then you can die anytime. Usually 2 weeks too long, 2 weeks, 3 weeks, a month, you pass on. But if you decide to do dialysis, then you can either do hemodialysis or peritoneal dialysis. If you are lucky, you get a kidney transplant. Transplant is the best option because it resurrects your kidneys. But in the absence of transplant, you spend your life doing dialysis.
Hello, my name is Kabren Gonde. This is Maggie Nubusi, and this is Kofi Awuga. And we are with World System Builder, an organization that's really on a campaign to provide financial literacy to the community. And our goal is to provide 1 million family financial education by the year 2020. And we're doing that really by providing education through this blue book. This is a book that teaches the basic principle of building a financial foundation. But because in this country there's so much wealth, but lack of knowledge is why so many of us are retiring poor. We also provide workshops at our financial center to help people now implement this in their everyday life. And we provide 6 financial classes from debt management all the way to retirement planning to wealth preservation so that we can educate ourselves, our family, and also our community. So we invite you to come to our center and really educate yourself. Thank you.
My name is Jefferson Dennis, and I'm from the West African HIV Task Force. The reason why we are out here today because African-born make up 1% of the population in Minnesota. That is according to the Minnesota Department of Health. And we are about 54% infected with the HIV and AIDS virus in Minnesota. There's a recent data just came out 2 days ago that shows that indeed African-born, the data is still steady. And this is why we are out here to let the public know that HIV and AIDS is no more a killer disease. There is a prevention. If you take your medication, there are medications now that can help people to suppress the virus to come to undetectable. And the good thing about becoming undetectable is that when you are undetectable, you cannot transmit the disease to your sexual partner. So there are a lot of medication out there. We even have another pills they call PrEP, which is pre-exposure prophylaxis. If you take the medication, it's a blue pills. It serves as a shield. So like after 72 hours, if you have sex, it helps protect you from being infected with the virus. So yes, we are telling people that. And another thing is that to know your status, we encourage African-born, to get tested. If you go to do your annual physical, tell your doctor that you want to do your HIV test. It is good to know your status, because if you know your status and you are negative, you want to keep it that way. If you are positive, you want to seek help. Thank you again. I'm Jefferson Dennis from the West African HIV Task Force.
Okay, my name is Wanlanjo. I'm here at the Sierra Leone Nurses Association Health Fair. I'm here to talk a little bit about my organization. My organization is based out in Brooklyn Park. We do basic computer training. We actually empower immigrants by providing them with basic computer training. Financial literacy. We also do job search and make sure that all immigrants that are coming in have the means to get on the computer and get the training that they need to succeed in this environment. So what's the name of your organization? The name of my organization is Wanlanjo. The name of the organization is Wanlanjo, and my name is also Wanlanjo. Oh, okay. Yep, it's a very good environment out here. There are a lot of companies that are doing a lot of events, and I thank you guys for it.
I am Kumba Kano, and I'm one of the leaders of Sierra Leone Nurses Association, SLNA. We're very excited about 2018 Health Fair. It's been a successful one, and we thank all our vendors. We want to thank the Sierra Leone community for helping us, for collaborating with us to get this program done today. This is a way of bringing our community together. It's a way of exposing our community to the resources that are out there. We know that even in the midst of abundance, in the midst of a lot of water or abundance, that's how they put it. I think Bob Marley once said it. You know, if you don't know where to find resources, you won't be able to access them. And this is the reason why we do this health fair. We do the health fair so we can access, so we can get our community, first of all, to come together, and then to learn about some health problems that we have in our community, some health conditions, and how they can best manage those conditions. And then we also, like just a gathering. Today is the Sierra Leonean Independence. It's Sierra Leone's 57th independence. And we want to wish everyone a happy Independence Day. And we keep doing this every year. We want to do this. We will have our luncheon for the Sierra Leone Nurses Association, and it's going to be on September 15th this year. September 15th, 2018, we're officially launching the Sierra Leone Nurses Association here in Minnesota. And it's going to take place in New Brighton, in the New Brighton Community Center, the New Brighton Community Center. So we want you to save that date. It's going to be a grand one. Sierra Leone Nurses Association, we're working really hard to keep our community together, and we're building our community. We're doing a health fair every year, and we're also reaching out to people so we can do like a senior outreach program. That's a program that we have in mind, is to get all our seniors that are 60 years and older to be in one room. They'll come together, we'll check their blood pressures, we'll do a medication check for them, and also they can do that social interaction. we all know that our moms and our aunties, they're home all the time and they're isolated from each other. They don't go anywhere except when they have a party and then they go somewhere. So Sierra Leone Nurses Association is working hard to bring that to an end so they can come out and socialize with each other. So we want to thank you for coming today. This is such an opportunity for all Sierra Leoneans in Minnesota, and we're appealing to the Sierra Leonean community to join us so next year can be bigger than this year. We want to thank you very much.
Thank you.